So now moving towards actually systematic contraindications for extraction. So let's start it. Bismillahirrahmanirrahim. In this, the first one is actually uncontrolled diabetes. In high blood glucose level, what happened that the advanced glycation and products are increased in accumulation in bone collagen. That's why actually it affects the strength and mechanical properties of the bone, due to which it changes the bone matrix and reduce the bone quality. तो आपकी bone की जो quality होती है ना वो बहुत ज़्यादा reduce हो जाती है. ठीक है. फिर हमारे पास इसमें रिएक्टिव ऑक्सीजन स्पीशीज़ में बहुत ज़्यादा इंक्रीज़ कर जाते हैं अमाउंट में, ड्यू टू विच इट इफेक्ट्स योर ऑस्टियोब्लास्ट, that is actually bone forming cells, that they are damaged, due to which the bone formation becomes really difficult. Fibroblasts, which actually forms the collagen, they are also damaged. There will be actually reduced amount of collagen formation. It also affects the bone strength. High glucose level also actually damage the blood vessels, due to which when there is actually reduced circulation to bone, when there is less circulation to the bone, so there will be less nutrients, less oxygen and less immune cells, due to which there will be reduced healing, and due to which the patient also suffers from impaired angiogenesis. Angiogenesis means the formation of new blood vessels. It is because there is actually there is low or less amount of vascular endothelium growth factor. In these patients this factor becomes really low. Okay, so we have actually microangiopathy in these patients also, they suffer. In renal failure patient, what happened that the amount of uremic acid actually increases, and due to which it affects the immune system like platelets. When platelets are affected, so there is no clot formation. So in these patients, their extraction is also contraindicated. In hypertensive patient, what happens actually when there is hypertension, increased blood pressure, so there is a vasoconstriction. When there is a vasoconstriction, so there is reduced blood flow. When there is reduced blood flow in the, if you do extraction in these patients, so there will be actually reduced blood supply to that specific area, and there will be actually a slow healing to that bone actually, of bone. Then you have blood diastasis. In this we have actually thrombocytopenia, hemophilia, leukemia. These are the blood disorders in which this is contraindicated, because if we do actually extractions in these patients, so there will be actually a continuous bleeding, like in hemophilia A and B. When you have deficient factors like 8 and 9, so the clot formation becomes very hard or very difficult, or it takes either long time and the bleeding continues for a very long time. Okay. Drugs. In drugs we have actually bisphosphonates, steroids or chemotherapy. It is also contraindicated because in bisphosphonate, what happens actually, it affects your bone remodeling and bone metabolism, and it also affects the cells that forms this bone, that like osteoblast, due to which actually if this is have absolute contraindications, that in these patients extraction should not be done, then the patient suffers actually from the bisphosphonate related osteonecrosis of the jaw actually. In pregnancy we do not do. In first and third this is actually contraindicated, but in second we do if the patient has very severe, but because in pregnancy the patient is very sensitive to each and everything, to drugs, to procedures. So unless if it is not very necessary to do extraction, so do not do it. It's better. But if it's very emergency condition, so then you have to do it. But if one can actually tolerate that pain and can, so in pregnancy second trimester you can perform this procedure, but in first and third you cannot perform this procedure, which is very important.